Hello, everyone. Welcome to Carrico and Petit Martinique Geriatric Care Services Supervisor Training, Module 1. The training objectives are to understand personal home versus nursing home care, understand the key responsibilities of a home care supervisor, understand the differences between leadership and management, learn effective leadership and management skills, and understand the importance of followership. Here we will discuss personal home compared to nursing or senior home care. For instance, related to the environment, in home care, of course, the client remains in their familiar home surroundings compared to a nursing or senior home that is structured and like an institutional setting, such as the Top Hill Senior Home. When it comes to personalized care, it is one-on-one care in the home environment. In a senior home or nursing home, the care is a shared responsibility among the staff and multiple residents. In the home, clients are more independent. However, in a nursing or senior home, there are more rules and routines, such as when the clients will have their baths, when they will have their meals, and there is less personal autonomy. For instance, in a client in the home may have the opportunity to go out more often than a client who is in a senior home. Family involvement is more common and more involved with a client who is in their home versus, unfortunately, at times those in the nursing home or senior home, family visits are usually scheduled at certain times, and again, some who may not even have any family visiting. Regarding resources, in the home, equipment may be limited, whereas in a nursing or senior home, you may have access to equipment such as wheelchairs, and you may have a hospital type bed where you can elevate up and down or even elevate the heads, and other specialized equipment for moving and transferring the clients. Social interactions. In the home, it may be fewer because some seniors are not able to get out as easily, whereas in a nursing or senior home, we could look at this as a positive because the residents are able to socialize with each other and with the staff. Staffing with home care, usually you have one or two caregivers. That is based on the abilities of the client. Some clients who remain in the home may have to have two or more caregivers or carers because of any limitations if they're not able to bathe themselves and the like. Whereas, again, in the senior home or nursing home, you may have a team of staff, such as the carers, the cooks, and in some places, in some of the other countries, you have particular assignments. You may have a medication technician doing the meds, and or licensed practical nurse may do some of the wound care. So multiple individuals and staff in the nursing or senior home. The duties and responsibilities of a home care supervisor include the following: management and supervision of the staff. The supervisor is required to lead, coach, and mentor the carers. Also, provide oversight of client care, such as maintaining quality of care and also carer performance. So, that's the quality of care of the clients, ensuring that they are safe. So, here is where quality assurance and compliance comes in, following the rules and regulations of the home care service and ensuring the carers remain compliant with the activities they are to perform and for their clients, and also maintaining the client's safety as well as personal safety of the carers. The home care supervisor also has administrative coordination and communication duties. For instance, the home care supervisor is a bridge. You are a connector between the office, the carers, and the clients. Notice that in your responsibilities, it started with the word lead. And that brings us to, what is leadership? Leadership involves influencing and directing others to reach shared objectives and goals. This process includes creating a clear vision, inspiring team members, and making important decisions to guide the entire group, the team, toward a goal or towards success. Success in caring for the clients. Who is a leader? A leader is an individual who works with others to develop and set a clear vision of the preferred future, and they really clearly describe the path of which needs to be taken to get to the goals and to the aim of the organization. Leaders also should create a healthy work environment, and this is for the carers, for the clients, the organization, and for themselves. An environment where individuals will be safe and comfortable in sharing ideas, in sharing if there is a concern or an issue. We should all be welcoming that opportunity to do better, because in the long run, our clients, safe care, safe, effective care, quality care for our clients matter when carers are in a healthy work environment, when our leaders are in a healthy work environment. There are some key elements of leadership. One is influence. Leadership involves influencing others, as I shared previously, to achieve goals that are in common to everyone. And this is often done through inspiring and motivating and persuading everyone, yourself, and your carers to achieve that goal. Another element is vision. Leaders usually provide a clear vision or direction for the future. What is the home care services? What will it look like in about a year, 2 years, 3 years, 4 years, 5 years? They will speak clearly about what success looks like and inspire others to work towards that success. Is it expanding the services, covering the entire island to the best of ability? All of our elders get appropriate home care services. Will Carriacou and Petit Martinique be a model for our entire country of Grenada, Carriacou, and Petit Martinique? Another element is communication. Effective leaders are skilled communicators, and they ensure that their vision, the expectations, and feedback are clearly understood. You see that feedback when the leaders share with the persons they're leading, they should get feedback to ensure that those persons understand the vision and understand where they're going. Another element is decision making. Leadership requires that we make timely and effective decisions, even when things are uncertain or if situations are very complex and not sure which way we need to go. But based on experience, we may be able to pull together, the leader pulls the carers together. What is the best approach to get things done? Another is adaptability. Good leaders should be flexible and should be able to adapt their style to meet whatever needs of the team or the changing circumstances in our environment turn out to be to get us to where we're going. And as I said, will it be the best home care services on the island, in the country? I said a model for the entire country. We could be a model for the Caribbean region going forward. There are some leadership theories that explain, in essence, what is leadership, different approaches to leadership. So, a theory, for instance, it gives you some ideas or set of ideas that explains facts or events. And again, that is explaining leadership. So, we have, for instance, these theories that in the past and currently explain what would make, for instance, a great leader and or what is the foundation of how they perform as leaders. For instance, it started with the trait theory, and that leaders have certain traits that help them be good leaders. Trait could be confidence, integrity, uh, and being able to be truthful. Those are some traits in leaders, and that has the foundation for trait theory. Behavioral theories, for instance, is that leadership is about specific behaviors, task versus the people orientation. How do they behave? Being prompt, being direct, communicating well. Contingency theories, for instance, indicates that leaders and leadership, it depends on what the situation is, what is happening currently during that era, during that time frame, or what is happening if it's in home care, how the leader behaves based on the number of clients that we're getting. Is the agency full at capacity? This could be the foundation for the contingency theory. Transformational leadership, on the other hand, describes leaders who inspire and transform followers to achieve higher goals. And we'll talk a bit more about that in an upcoming section. On the other hand, we have servant leadership, which identify leaders who prioritize serving their followers' needs uh, over some of the other uh, descriptions that we've done previously. And in essence, leadership theories give a broad explanation of leadership, and leadership styles will describe the way leaders choose to interact with and influence their team and the people that they work with. A leadership style also can help the leader be more effective, and that is often based on how that leader behaves in the different situations. Here we will highlight leadership styles. So, for instance, autocratic. We have where this leader primarily makes decisions alone and usually do not get input from the followers, makes decisions that they want followed. For instance, a geriatric care supervisor makes all decisions during a shift without consulting the carer staff. That geriatric supervisor may assign duties, set the schedule, give specific instructions on how each task should be completed. If a carer suggests a different approach, the supervisor dismisses and insists on that way must be followed to maintain control and consistency. This is an autocratic leader because that geriatric supervisor maintains full authority, makes decisions alone, and expects strict compliance. On the other hand, we have the democratic leadership style, and this involves team members in decision making. For instance, the geriatric care supervisor holds a weekly meeting with caregivers to discuss client care plans. The geriatric supervisor encourages everyone to share their observations and make suggestions. And when deciding how to improve a client's care routine, that supervisor listens to input from all the carers and includes their ideas in the final plan. This is democratic because the supervisor involves the team in decision making and values their opinions. We have laissez-faire. This leader offers little guidance and lets the team take the lead. And an example, a geriatric care supervisor gives caregivers their schedules and basic guidelines, then allows them to manage their clients' care as they see fit, rarely checks in unless there's a problem, and trusts the caregivers to make day-to-day decisions on their own. This is laissez-faire because the supervisor takes a hands-off approach and gives the team full control. This can be a challenge because you do need to have a leader who is taking some control of situations and the care of the clients. A transformational leader motivates and inspires the team. The geriatric care supervisor inspires our team by sharing a vision of providing not just care, but comfort and dignity to every client. This supervisor will motivate caregivers to take extra steps in building strong relationships with their clients, encouraging them to pursue training, learning more, and recognize their efforts publicly to boost morale and professional growth and development, similarly to what is happening here. This is transformational because the supervisor focuses on inspiring, empowering, and developing the team to exceed basic expectations. Remember talking about leadership and the ability to set that vision, set that goal to get everyone to that end. Is the geriatric services program in Carriacou and Petit Martinique. Will you become the shining example for the entire country? And like I shared, a shining example for the Caribbean in how we provide leadership in our program. On the other hand, we have a transactional leadership style, and these leaders work with providing rewards for good performance and manages by exception. An example, for instance, the geriatric care supervisor may set clear rules, and if caregivers arrive on time and complete all their documentation correctly, that is done for their clients in the home, they may receive a bonus, or they may get some accolades more than other carers. And if tasks are missed or they're late, they may get a warning or lose particularly some privileges. This type, the transactional geriatric care supervisor, may focus on meeting goals through rewards and penalties. And the supervisor has structured expectations for performance monitoring and provides some clear consequences. You may click on the link to look at a video that gives some more information about these 5 leadership styles. Another leadership style is authentic leadership. And this type of leader leads from the heart to influence others to achieve the goal. This leader is usually very caring and incorporates shared decision making with the followers. This leader is also very resilient and has the ability to recover quickly from challenges and difficulties. And this type of leader also has a strong sense of self. As we go along and learning about leadership, you may see where there are different situations where the different types of leadership styles that were presented may be used in particular situations. And this helps to know, especially when to use a particular leadership style. For instance, I have identified with being an authentic transformational leader but know when to make autocratic decisions. For instance, we usually give the example of working in the ER. Someone comes in and is in for a serious situation. One person may have to take the lead and give directions. So there are times for this to happen, but we have to know when. And if there is an imbalance, then we may not have a healthy working environment that we emphasize that leaders should ensure is occurring for everyone, the followers, the clients who receive the care. If carers are not happy, then unfortunately that may transfer to the clients being taken care of. Why does leadership matter? As it's shown here, teamwork is improved. There is increased motivation, wanting to do the work among everyone, carers included, leader included, have that clear direction where we're going. You saw was emphasized previously. Innovation and change can occur, and the organization becomes successful. The geriatric care services becomes successful, and that is dependent and part of what we do when we provide our full self in this leadership process. Ultimately, our client benefits. The client, we provide a service to the client, and without them, we do not have the opportunity to be leaders. Who would we be taking care of? Who would be there for us to take care of, to be able to share? We want to get our organization, our geriatric care services, to that successful end. We were discussing leadership. Now, what is management? Management is a very generic or basic function that includes focusing on completing the work that must be done. Remember that vision, that work that the leader created and put together for where we need to go? The manager has to make sure that we get there. So, some primary functions of management or the management process ensures that we get there: planning, budgeting, organizing, and staffing, controlling, for instance, ensuring that the clients, we know where they are, who our clients are, maintaining good record keeping, and also that manager has to have the skill to problem solve when something comes up. For instance, with staffing, something comes up with the clients that we're taking care of. Here, you should be able to click on these links to get some more information through videos that emphasizes what management is, what leadership is. As we said before, leadership is about setting the direction and inspiring people to getting us to achieve those goals that are set. Whereas management, as emphasized, is about planning, organizing, and controlling the day to day moments of getting to the goal and to that success. Both are important. Leadership focuses on the vision and motivation, and management focuses on how do we achieve what that leader set as the vision for an organization or for the geriatric care services of Carriacou and Petit Martinique. As we continue to look at effective leadership and management skills, you will see in this video that is about 15 minutes a focus on Caribbean women in leadership. And you should also see there is a great connection to Grenada, and I hope you do enjoy this video. Who are the followers? This is the importance of followers. These are the individuals to whom leadership is directed. They complete the tasks and ideas set forth by the leaders. You need leaders and followers still. And at some point, leaders are also followers. All are important. Followers also have different followership styles. Followership styles. Our exemplary follower has a high level of active engagement and high level of independent critical thinking. Their characteristics include a willingness to take the initiative. They provide constructive critique. They take ownership and champion the goals of the organization. Or with geriatric care services, they'll champion the goals of the geriatric care services and share all about what they're doing. The conformists, on the other hand, these followers have high levels of active engagement, but they're not high on critical thinking. They are active doers, and they're often seen as team players. They're willing to accept assignments and are usually trusting of their leaders, but they very often will put the needs of their organization over their own. The passive follower, on the other hand, they tend to fall on the lower end of both engagement and critical thinking. They follow the leader without question. They need consistent direction. And they might be the kind of persons who put their time, but little more. That's it. And they may believe that the organization and its leaders are uninterested in their ideas. And this lets us know we have different people working with us, and we have to know how to work with them to get the work done. The alienated follower has high levels of, they are good critical thinkers, but they're not there to engage very much in what is going on. They see themselves as folks who are highly skeptical about others, and often not the seen as the greatest team players. And they might feel their leader doesn't fully recognize or use their talent well. So knowing your different carers and their styles help you know how you need to interact with them to really get that job done. The pragmatist follower has moderate levels of engagement and moderate levels of critical thinking, and they may feel like their work is full of uncertainty and not sure where things go, and how things are going. And they're seen by others as people who play potentially some political games, but they see themselves as people who know how to work the system to get things done. And even in our uh, system, in the work with the geriatric care service, that could be there as well. I know I'm sharing information that may be so aligned with, in line with what is happening in your more developed countries like Canada, the US, and the UK, but really, people are people everywhere. Like we have good leaders, we also have good followers. Good followers will partner with their leader and really support what is going on and be committed to the shared values and goals of the organization, the shared values and goals of the geriatric care service of Carriacou and Petit Martinique. They're usually passionate about their work and the people that they serve. And if they are not passionate, they're not content to accept it as normal. They usually defend their leaders and keep persevering and know how to respectfully challenge a leader when needed. They're also very self aware of their abilities and do not hesitate to ask for support and guidance when needed. They also seek to get feedback on their performance, check to see how they're doing, and get what their strengths are and what the areas for development and growth are so that they could work on those. Again, they focus on personal growth that is aligned with ensuring the mission and the goal, the success of the organization or the success of the geriatric care services of Carriacou and Petit Martinique. And a good follower also does not compete with the organization, and they are there to become aligned or work with the organization, work with the geriatric care service to get things done for the clients that they serve. So we've previously focused on leadership and management. Now I want us to take a review of communication. On the first sections that we've done and doing our review, I noticed that we could all, including me, really focus on how we're seeing what the skills of communication are, the different types of communication. And so hopefully this slide will be able to help. And we want to highlight communication can be verbal, and this is when we need to be strong, confident, and also we need to use active listening when somebody else is speaking verbally, and we must listen carefully and also avoid using words that others may not understand. Uh, Communication can also be nonverbal. I want us to remember that. And we want to notice how our emotions uh, might play a part in the communication process, and also the nonverbal communication of our carers, our clients, and anyone else that we work with. We know that communication can also be visual. This is communication on these slides right here is part of visual communication, and written, of course. And we want to write as simple as possible. I am hoping that even though some of the content here may be unfamiliar, but that they were explained in a manner that will be understood. And if not, please don't hesitate to reach out to me uh, for explanations. Also, please review the personal care attendant training at the communication information on slides 6 through 16. That should be very helpful with our continued focus on communicating clearly and effectively with each other, our peers, with also the carers, and with our clients. Thank you for going through this module 1 and looking forward to us getting to module 2. Please do not hesitate if you have any questions to reach out to me.